Now, the ORION-9 study was a study done in just under 500 patients with heterozygous familial hypercholesterolemia using a novel drug, an antisense called inclisiran, which inhibits the production of PCSK9 by the liver, unlike the monoclonal antibodies which mop up PCSK9 within the circulation. And the overall results of the ORION-9 study was about a 45% reduction in LDL cholesterol in patients with heterozygous familial hypercholesterolemia. At this late breaker, I presented the results of the underlying genotype. So we genotyped about 2/3 of the patients in ORION-9, and it was important to see if those with null LDL receptor mutations, as opposed to those with what we call defective LDL receptor mutations, would respond similarly. So interestingly, in the study, about 37 patients of the whole cohort had 2 mutations. So they were actually compound heterozygous or homozygous FH patients, at least genetically, although clinically they were thought to have heterozygous FH. And the other patients were divided into those that had what we would call null LDL receptor mutations or defective LDL receptor mutations. And interestingly, overall, the response in terms of LDL reduction was very similar in those with 2 variants, so 2 mutations, those with null LDL receptor mutations, and those with defective LDL receptor mutations. So it appears that inclisiran is effective in all patients with familial hypercholesterolemia, as long as there is some residual LDL receptor function. In homozygous patients who have no LDL receptor function, very much like the monoclonal antibodies, this medication is probably not going to be effective. But in the remainder, as long as there's some residual LDL receptor function, inclisiran is a remarkable drug given only twice a year, and it will reduce LDL cholesterol levels in the order of 45 to 50% in patients with familial hypercholesterolemia.